NHI is not going to fix those things. You could throw more money at a dysfunctional system, it's not going to fix it. You have to fix the fundamentals, the management of it, those sorts of issues. So I think, if we can get to that, and then you don't need an NHI, you just need to fix what you got.
Recent comments by Nicholas Crisp indicate that the NHI is proceeding full steam ahead. Joining me to unpack is Michael Settas. Now, Mike, Dr. Crisp, who is the Deputy Director General in the Department of Health, said that both spaces, i.e. public and private, don't do well. The one just looks prettier than the other. So we're on a hiding to nowhere with these current systems. He also said that the NHI will be a game changer and that it is, quote, a massive multi-year reform program for the health system going forward. Now, Mike, what do you think of those comments sort of off the top of your head, just to start off with? How do you think Dr. Crisp is couching the NHI at our current point here halfway through 2022?
Oh, thanks, Chris. Look, I think you might be right in that the one is quite a lot prettier than the other one. But it's probably because it's also much better than the other one. We don't need to really elaborate on where we sit with that. But I think this idea of trying to state that both sectors have these insurmountable problems it's an attempt to try and justify why the NHI proposal is saying what it says. It wants to nationalise the private sector, amalgamate it into the public. So, and to me, I think those are cheap shots, to be honest. The private sector has problems. There's no question about it. I mean, we had the 6-year-long health market inquiry, which did a massive amount of investigation and engagement with the private sector, and it came up with a blueprint on how to fix it. And I think it's very regrettable now that blueprint is now just being shelved in replacement for NHI, which is largely ideologically driven. There's been very little technical feasibility analysis done on it. To this date, we still sit with no costing on it. We're diving into a black hole we know nothing about. So, I don't see. I can see his attempt at what he's trying to do to justify why the NHI should proceed, but I think it's a rather weak argument, to be honest.
There is a perception that if only the public sector and, let's say, the Department of Health in this case, or the NHI board, the NHI fund, if they had access to all the money in the private sector, and especially in medical aids, they could improve the public facilities and public systems. That could be the sort of cure-all. I think it ignores a lot of the governance and rule of law concerns. I mean, in his recent comments, Dr. Crisp talked about how South Africa spends 8.5% of its GDP on health, and, quote, given the size of this resource, end quote, it's even worse that the two health systems are not functional. He also said that South Africa has the 35th biggest economy in the world, and on that basis, we perform very badly on health outcomes. But is there any merit in saying, let's throw money at this problem that would help solve, basic issues, maybe personnel issues, infrastructure issues? Or do you think maybe the vision of the NHI is missing the point here?
Well, I think, the political answer to everything is more money. That's kind of like a stock standard. So I don't think we're any different in that way. But again, it fundamentally ignores that the public sector budget, health budget, from 2000 to 2020 doubled in real terms and per capita terms, doubled. Now, that's an enormous increase in resource. So if Crisp's argument that it's a resource issue, and that's what, we're not getting, then, why is the public sector outcomes, why aren't they better than they are? All we see on a daily basis is a decline. Virtually every day you'll read a publication somewhere that will have some story about some failure in the public sector. It's now becoming so obvious that it can't be ignored. But to argue that it's a resource problem it's complete nonsense. As I say, the financial budget has doubled in the 2-decade period. In terms of personnel, in the 2019 Human Resources for Health Review, published in 2020, showed that the number of medical personnel employed by the state is 50% higher than what it was in 2006. It's a massive increase in human resource as well. We should be getting much better outcomes. I'm not to say it's not nirvana. We're not going to have world-class first world healthcare, but the trend should be upwards, improving because of this massive increase in resource. But why are we not seeing that? It clearly points to what you referred to, The Auditor General said it, the Office of Health Standards has said it. There's just a complete lack of governance. The frameworks have been either dismantled or removed, and there's just simply no management. There's no accountability within the department, which leads to things like widespread moonlighting by public sector medical personnel. I mean, a study by Professor Raspel from Wits University some years ago, 40% of public sector nurses are moonlighting to a large degree. So they're employed and paid by the state, but they're actually working and being paid elsewhere in private. I mean, that, and if they're assuming that that is widespread elsewhere, and the indications are that it is, that's a big problem. And why is it not being addressed? The department is completely mum on it. You don't hear anything. Certainly Dr. Crisp doesn't say anything about it. So, NHI is not going to fix those things. You can throw more money at a dysfunctional system, it's not going to fix it. You have to fix the fundamentals, the management of it, those sorts of issues. So I think, if we can get to that, and then you don't need an NHI, you just need to fix what you got. I think we forget that South Africa's public sector is a very substantial asset, by far the biggest public health system on the African continent, by miles. And it's, we really should be doing much better. I agree with that part of what he says, but I don't agree that we need an NHI to get to that better point.
And then, Mike, just a final question in terms of heading towards 2024 and national elections, putting you a bit on the spot. Do you see the risk of the NHI being pushed through now increased based on these recent comments? Do you think we'll have an actual NHI before 2024? Do you see it more as being used for political expediency and talking points and that sort of thing, and we will see more of these comments before 2024?
No, I think the political expediency is the key issue there, and I think that's what is what's happening now. I mean, we're only 2 years away from the next national election, so that's not really a long time in the political world. It takes decades to build national health systems. A lot of countries have done it, but I think, in South African context, we need to actually step away from this concept of having to build a health system. We already have a health system. We don't need another one. We've got the public health system, as I said earlier, a very substantial asset. And I think in terms of comments about the private sector, I think a lot of private sector players, especially the funders, have been sort of quiet. They've sort of diplomacies, they're endorsing the concept, saying yes, the providers not so much. I think the hospital groups have come out a lot more, in arguing against the NHI, saying potentially that they'll go to court, if this thing does go through as it is, because it is going to be quite damaging. But I think to come back to that point, it's all about selling a political aspect now, but we don't actually need to sell it. What they should be selling is, we've got a very substantial public health system. It's got lots of problems. But the asset's still there. We haven't lost the assets. We've got the hospitals, we've got the clinics, we've got the people. Let's fix the internal. And I think we could do a heck of a lot better as a country in terms of providing health than saying we're going to build this new fancy system, which, even if they could build it, which I don't think they can, will be decades away. But if they fix the public health system today, I think within a few years they could have it have it repaired and in a better state than it is now.
Thank you very much for watching. Let us know in the comments below, what do you think of the proposed NHI? Do you think it will improve or lower South Africa's health outcomes in both the private and public healthcare sectors? What do you think is motivating the push for the NHI to be implemented? Remember, please, before you leave, to like the video, also subscribe to our channel if you have not yet done so. Thank you for all your support. Until tomorrow, this has been Chris Hattingh for the Centre for Risk Analysis. Take care.